I'm Dr. Larry Santora. Thanks for watching Heart, Health, and Home. Today I'm going to talk about the effects of medications that are used to treat COVID on your heart. And then I'm going to be followed by Nikki Johnson, who is a Medicare insurance specialist, and she'll talk about what's going on in that realm in reference to COVID. And then we'll be followed by Mary Sanchez, who's a real estate expert, and she will give us some follow-up on the real estate market in response to this COVID pandemic. The drugs that are most commonly talked about as far as adverse reactions to the heart are hydroxychloroquine, which is called Plaquenil, that's used often to treat lupus and malaria, and has been out for 50 years and is proven very, very safe at appropriate doses, and also azithromycin, which is a broad-spectrum antibiotic. So I get calls all the time from patients, can they take hydroxychloroquine? I do not prescribe that, but if your physician chooses to do that, since there is some evidence that it does work, I think we can monitor you safely by doing a 12-lead EKG and look for certain measurements. They alter the EKG in a certain way. They call prolongation of the QT interval, and I'm going to show you that. What we do is we measure a certain interval called the QT interval. The QT interval is this is one heartbeat, and this is the beginning of the heart contracting, and this is the relaxation phase. This is the Q wave, and this is the T wave, so we measure the QT interval. If this becomes prolonged, meaning it's longer than halfway between the two beats, we call that QT prolongation, and that means you would be at increased risk of having abnormal heartbeats while taking the hydroxychloroquine. So if your doctor recommends that you take that and you haven't had a tendency towards abnormal heart rhythms in the past, and you measure the QT interval on a 12-lead EKG a couple of days after starting the drug, I think most people can do fairly well and take it in a safe manner. So you can start the drug, come in and get the EKG. If it looks like it's prolonged, meaning it's affecting the electrical activity of the heart, that will put you at an increased risk of abnormal heart rhythms, and then we would have to probably stop the medication. You probably shouldn't take either of those if you have a tendency towards abnormal heart rhythms, since you will have a tendency to have that be exacerbated by these drugs. The other common drugs that are commonly talked about are the ACE inhibitors and ACE receptor blockers. These are common blood pressure medications, and like losartan, lisinopril, these Benicar, Avapro, and these drugs are part of a receptor in your lungs that the virus latches onto. And so there's some question whether they would have an adverse reaction. If you are on these drugs, should you stop those? Because they're very, very ubiquitous as far as blood pressure medicine. But I think they're very safe to take, and they should not be stopped without your doctor's advice. So I think it's still okay to take ACE inhibitors and ACE receptor blockers. The other drugs that might cause an adverse heart reaction are the anti-inflammatory drugs like dexamethasone or Pulmicort. Pulmicort is an inhaled or nebulized steroid which directly gets to the lung inflammation, and the dexamethasone is a steroid that's given intravenously, and there are some adverse reactions with steroids, especially intravenously, where they can cause some fluid retention. But I think as far as I don't think that's going to be a big deal with your heart, and if you have fluid retention, we can give you diuretics if need be, because these drugs are so important. These anti-inflammatory steroids are so important in combating the COVID virus, and we get new reports every day that they're game changers, especially the inhaled steroids like Pulmicort, which does not cause much fluid retention because it's a very low dose that gets directly to the lung tissue rather than circulating through the bloodstream. So in my opinion, I think that most of these drugs, if properly monitored, can be given to you, and I think the goal should be to treat the COVID virus early and vigorously with reasonable doses of all these medications, and properly monitored, I think you can get by very, very well without a problem. Thank you for watching. We're going to come up with new treatments next week. We're going to talk about other various heart-related treatments and how it fits into this whole pandemic. Right now, we're going to be followed by Nikki Johnson, who is a real insurance expert, and then Mary Sanchez, who's a real estate expert. Thank you for watching. See you next week.
Hi, I'm Nikki Johnson, a health insurance agent specializing in Medicare. Today I want to talk about MAPD plans, also known as Medicare Advantage prescription drug plans. As it states in the name, prescription drug coverage is included in these plans, and typically these plans have a network or medical group that you choose to join. A medical group is the network of contracted physicians and hospitals that you access care from. This means you pick one primary care physician, also known as a PCP, and anytime you need to see a specialist, that primary care physician will put in a referral or authorization to get approved for you to see the specialist. It's important to note that typically, if you access care outside of this network or medical group, you could be responsible for the full medical bill. So it's important to talk to your PCP about who you go to see when you want to see a specialist. Also, it's very important to note that the medical group is different than your health insurance company. So it's important to research both when you're choosing the appropriate health plan. Now, many Medicare Advantage prescription drug plans include value-added services. These can be things like vision, dental, hearing exams and hearing aids, and also things like gym memberships. Medicare health plans and medical groups are rated by Medicare on a 5-star rating system. Those with a higher quality plan typically have a higher star rating. Medicare uses 5 different categories to rate health plans and medical groups. It includes things like staying healthy, managing chronic conditions, member experience, and customer service. With over 40 options here in Orange County, many people ask, how do I choose which plan to go with? Well, typically things like star ratings, the medical group or network of physicians you want to access, and your specific prescription drugs would be key factors in picking the best plan and medical group for you. I can help you walk through any of this, including running a prescription drug analysis and reviewing your specific doctors to choose the best plan for you. Any questions or concerns, please reach out via email, text, or call on the number listed below on the screen. Until next time.
Hello, my name is Mary Sanchez. I specialize in residential real estate here in Orange County, and today I'd like to talk to the first-time home buyer. Now is a great time to buy, with interest rates being at record low and personalized loan programs. My best advice for any homeowner, especially the first-time home buyer, is take time to prepare. When the time is right, you will not only be ready, but you will be confident. I have 5 tips, and I hope that you find this of value. So tip number 1 is boost your credit score. Your credit will play a very important role in your mortgage approval and in the interest rate that you pay. Order your credit report on annualcreditreport.com. My tip number 2 is plan on needing approximately 20 to 30% down payment to qualify for the best mortgage rate. Beware that the interest rate will be higher if you require a PMI, which is a private mortgage insurance. Tip number 3, find the best real estate agent, one that knows your area well and one that specializes in working with buyers. Tip number 4, get pre-approved. Knowing what you can afford, what you qualify for, and what type of loan you want can help you find the best deal. When you are ready, to apply for your mortgage loan. Tip 5, find the right home. Start researching as much as you can and as soon as you can. Use online resources such as Redfin and Zillow. Start early in your search and knowing what neighborhoods are your target cities, and viewing homes online to get an idea of pricing. Once you're ready to purchase, you will have a much better idea of what you want, where you want to live, and what you can afford. And if I can be of any help, I would be more than happy to answer any questions that you may have. Feel free to call me, and hope you find today value.
Well, I want to thank you for watching the show today. I have a deal for you. I'm going to send a item that may save your life. Actually, 2 items that may save your life. So the first 50 people who write into our email address, hearthealthhome@yahoo.com. The first item is a book that I wrote called The OC Cure for Heart Disease. This, I think, has potential to save your life because it talks about the coronary calcium screening test on the electron beam CT scan. This is the single most important test, I believe, in medicine today. I wrote this book with NFL superstar Dick Butkus. It tells his story, and it tells you all about heart disease and how to utilize this very important test. I think you'll enjoy it, and it'll be yours for free. The second thing I'm going to give you that may save your life is this fantastic mask. I use this cloth mask instead of the paper ones, and it's very, very comfortable. You can talk with it. It doesn't smother you. It's not hot. It's washable, and frankly, it looks much better. And it also comes in different colors. Obviously, we can't give you the color that you want, but we will send you the book and a mask for the first 50 people who write in. So thank you very much for watching the show. We appreciate any comments that you may give us. Hopefully they're good comments, and we will see you next week. Thank you for watching. I'm Larry Santora, and this is Heart Health Home. Thank you.